Hello, this is Dr. Kant Shah, Pediatric Surgeon, and today we are going to talk about an interesting type of surgery called the Stentless Hypospadias repair. A lot of parents whose children have hypospadias repair want very few dressings and they don't really like having a catheter. And this is where the era of stentless repairs started. I will briefly tell you what is hypospadias, what is the surgery, and then we'll go into the details of what is a stentless repair for hypospadias. Hypospadias is a condition in young boys or even adult males sometimes where the hole or the tip of the urinary passage called the urethra is slightly lower down on the penis, or it may be much lower down towards the scrotum. This may be accompanied with a bend in the penis called a chordee. Due to this, there may be two functional problems. Either the urine may fall down towards the leg of the child, or because of the bend, there may be future problems with sexual life. For both of these, a surgery is recommended, which is called a urethroplasty. Now, when we do a urethroplasty surgery, the surgery actually depends on many factors. One of them is the location of the current urethra which the child is born with, the bend in the penis, which is chordee, which I said, but also about the availability of the local tissues which are soft and supple and available for reconstruction of the urethra which we want it to be at the tip of the penis. Such a surgery called hypospadias repair or sometimes urethroplasty is usually done between 6 to 18 months of age. The common names of these repairs are tip repair, Snodgrass repair, onlay flap urethroplasty, Matthew repair, and sometimes staged procedures where we do multiple surgeries 6 months apart in 2 or 3 stages. Traditionally, due to the fear of leakage of urine, all these surgeries were accompanied by keeping a small tube in the newly made urethra, which is called a stent or a catheter. However, as science developed, there were many surgeons who tried doing a stentless, which means we don't keep a catheter, that kind of surgery. Now, what is stentless repair? It means that the tube which we have reconstructed is adequately supported by multiple layers of tissues, and hence the expected leak rates are less. And in such cases, we may completely avoid the stent or a catheter. And this is stentless hypospadias repair. What are the benefits for your child? Of course, it's much more comfortable for the child to not have a stent or a catheter. It's easier for you to look after the child, and sometimes the healing is also a little faster. It is important to understand that not every child can undergo stentless repair, and almost always this decision has to be taken at the time of the surgery and not before the surgery. So what happens differently in a child who undergoes stentless hypospadias repair? Well, they will undergo the pre-operative tests, undergo general anesthesia, and the surgery will happen. During the surgery, if the surgeon finds adequate tissue layers to support the tube repair, then a stent or catheter will not be put in and a simple dressing may be put to cover the repair. Usually, the child will pass urine on their own without the stent or catheter through the newly formed tube, and the dressing may be removed even within a day or two. In the initial period of 1 to 2 days, there may be some discomfort that the child may experience, for which painkillers and what we call a sitz bath, which means making the child sit in a warm tub of water, is usually done to reduce the edema, swelling and the pain. Most children who undergo stentless hypospadias repair are playful within the first day of surgery, and it is much easier for the parents because no special dressings are required. As is common for any hypospadias repair, painkillers, medicines to reduce the swelling and antibiotics would usually continue for about a week. As a parent, we would want you to notify us if there is excessive swelling or redness, or if there is any sign of an infection. Also, if the child has any difficulty in passing urine, we would expect you to come back to the hospital. What are the long-term outcomes for such children? They are comparable to children who undergo a stented or a catheter-based repair, and hence, in suitable children, we do offer stentless hypospadias repair. So, as an example, there was a 7-month-old child who had what is called a distal hypospadias without a bend or a chordee, and this child was found very suitable for doing a stentless repair. For the first day or two, we kept this child admitted in hospital until the parents understood how to look after their child in the post-operative period, like giving the warm water tub baths and ensuring that the child is passing urine adequately. Within a couple of days, the child was so well, it hardly suggested that he had undergone an operation. And the outcome was so good that today you cannot tell that the child has had surgery. So stentless repairs are great for those children in whom it is suitable and the tissues are ideal for those. And if you are anxious to know more, then please do write in the comment section. And if you like what we do with our videos, then please do like and subscribe our channel. Thank you.